This town is a festering pot of infectious agents. All of them are swapping virulence factors with each other like it means nothing, like they're in it just for the pathogenicity. It is one separative infection after another, and each strain is more disgusting and infectious than the last. And now there are cases of feline conjunctivitis flaring up on every corner, in every household, and no one knows who is to blame. My name is Detective Kevin Arnold, and I have been put on the case to determine the infectious agent that has been causing conjunctivitis in this town, and I intend to bring them to biomedical justice. A cat by the name of Captain Mittenpants had the itis real bad, so I decided to have a talk with her. Hello, Captain Mittenpants. I'm glad to see you are on the mend.
Thank you, Detective Arnold.
I need to ask you a few questions to try to help me determine who infected you. What types of symptoms did you have?
Well, I had red conjunctivae, swelling of the conjunctivae, ocular discomfort, eyelid twitching, and mucoid and mucopurulent ocular discharge. I was also lethargic.
I see. Thank you for the information.
Sure. Do you know who could have done this to my eye sockets? Could it be more than one agent?
She was right, though. It could be a few different agents, and I had 3 in mind. Now it is the time to interrogate each culprit to determine how they may have acquired access to the victim. Let's start with the dreaded herpes. Where do you replicate?
I'm a very serious pathogen who replicates in the mucous membranes of the respiratory tract, conjunctiva, and cornea of the cat.
I see. And how do you gain access to your victims?
I am shed in large quantities by acutely infected animals with a small amount of virus being shed in the oral, nasal, and conjunctival secretions of latently infected carriers during recurrent episodes. The main mode of transmission is from direct contact with an infected cat, but fortunately for me, and unfortunately for the suspect, I can remain viable for up to 18 hours in a moist environment, making indirect transmission possible via contaminated cages, bedding, utensils, and personnel.
So, do you cause this awful crime of conjunctivitis on your own, or do you work with other criminals?
People always assume that I work with other criminals like chlamydiophila and mycoplasma, particularly when it comes to conjunctivitis. However, I usually just cause the disease on my own. Of course, as with any disease, and particularly when I get into the upper respiratory tract, other guys try to move in and cause more of a problem.
Perhaps a specialist could help me with my detecting it and give us some insight as to the virulence factors of the causative pathogen. You look smart.
Thank you, Detective. I'm very excited to get to the bottom of this troubling case. I'm the specialist. I was listening in behind the double mirror to interrogate herpes. Herpes has a wide range of virulence factors. Many of its virulence factors are for immune evasion, including proteins produced that downregulate MHC antigen presentation and inactivate the complement cascade. It can also produce a protein that prevents apoptosis of the cell, allowing it to complete its replication. In addition, herpes produces many virukines that help accelerate their DNA synthesis, allowing for rapid replication. And of course, its ability to lay latent in the host cells allows the virus to persist for life once contracted.
Thank you. And Mrs. Mycoplasm, where do you replicate?
Despite my tiny little genome, I'm capable of self-replicating. This can only be done, however, once I invade my host's epithelial cell. It's nice to be able to take advantage of some of their metabolic machinery. Besides, I'm an expert at avoiding their immune response by constantly changing my surface proteins.
I see. And how do you gain access to your victims?
I'm a very unique little pathogen in that I lack a cell wall. I do still, however, have many surface adhesion proteins and am capable of secreting signaling molecules that allow me to attach and invade my host cells.
We seem to see you a lot around these conjunctivitis cases. Is there another pathogen that you ever work with?
No, I generally prefer to work alone. It does often seem like when I'm there doing my thing, though, other criminals like herpes virus or chlamydia ophila may be around too. We don't work together, though.
I am not a good detective. What do you think of this one, Miss Specialist?
Mycoplasma is a sneaky one too. Very little is truly understood about this tiny parasitic bacteria, particularly when it comes to its virulence factors. One thing that we do know is that it is very successful cell invasion capabilities. Mycoplasma has the ability to bind to plasminogen inside the host, and by the use of urokinase, it can activate it into plasmin. Plasmin is then an active protease that can convert the outer cell membrane proteins of the mycoplasma, favoring it for cellular uptake.
Chlamydophila felis, long time no see. Where were you last night? Around 8 o'clock.
Ugh, keeping to my own business. I was in the cytoplasm of epithelial cells, just replicating.
Exactly what I suspected. Now tell me exactly how you infect your victims.
Well, I can't survive in the environment without a host, so I depend on cats in close contact. Usually go for an unsuspecting group of kitties, usually that live with each other and mutually groom each other. This makes my spread of infection all the more likely. I love ocular secretions. First, I attack the conjunctival epithelium of the eye by attaching to sialic acid receptors, and then I enter the cell. My mom always told me that I was special because I have a unique replication since it's in the cytoplasm of epithelial cells. I then leave the cell by inducing lysis to release my infectious bodies to spread to other epithelia systemically.
Are you working together with anyone on this? Is this gang related?
No! I take full pride and credit for all of the crimes that I have performed. Little herpes and mycoplasma are always trying to brag about it and act like big shots, claiming to have caused so many infections. Psh, I work alone. I hardly ever work with those fools.
Those gangbangers? Where's that darn specialist again?
Hello again, Detective. Everything Chlamydophila said is true. However, she withheld the fact that she gains entry to the host cell by PMPs, which are polymorphic membrane proteins. These proteins are present on the outer membrane of chlamydial organisms like herself and are targets for inducing protective immune responses. She uses a small circular plasmid as a virulence factor too.
Aha! Damn sneaky chlamydophila. Never telling the whole truth. Unfortunately, withholding information isn't enough evidence to hold up in trial for this conjunctiva crime. Maybe this robot can tell me about diagnostic techniques used on these agents.
Feline herpes virus can be diagnosed in 3 ways. Culture of the virus, PCR, immunofluorescent antibody test. PCR is the most sensitive test, and is obtained from a swab of the tissues around the eye, which is frozen, and sent by overnight mail to a special laboratory. It is very difficult to diagnose feline herpes, unless the patient is having an outbreak. Additionally, the transport of the sample, and the amount of DNA of the virus collected makes detection difficult. Mycoplasma felis has traditionally been diagnosed by bacterial culture, but it can be difficult to grow. The Molecular Diagnostic Unit has recently developed a sensitive quantitative PCR assay to detect M. felis in cats. It uses an internal amplification control to ensure that a valid diagnostic result is produced for every submitted sample. Samples that can be submitted include transtracheal wash, bronchoalveolar lavage, ocular swab, throat swab. PCR can be used to detect Chlamydophila felis.
Diagnostics are boring. I'm just gonna arrest all 3 of them jerks because I know that they could all cause conjunctivitis. Most of the time they work individually, but sometimes 2 of them can work together. Get in there!